getting a little more advanced with our thoracic cage mobility. We're still focusing on improving spinal joint motion. And in this next series, we're looking at targeting 3 different regions more specifically than what we did on the ball, which was general thoracic cage motion for the thoracic cage as a whole. Now we're going to look at the upper, the middle, and the lower thoracic cage. So we're using this half styrofoam roll. You could use a full styrofoam roll. It doesn't have to be short, but we're going to place it underneath the upper thoracic cage. And how do you find the thoracic cage? That's easy. All you do is feel where the first rib is. And where your neck ends, the first rib sits. And then we need to have this body, this patient, to be on the styrofoam roll just a little bit under where the first rib is. So you would scoot that way about 2 inches. That's too much. Too much. Right there. Okay, now we protect the neck with a skull, and a neck hand. And the neck hand is spread so that we have a top and bottom hand, and the bottom hand on the neck covers the whole cervical spine. Then we have the knees bent so that the low back is less likely to move. So we have the neck totally supported. We have the low back passively positioned so it won't move, and the target will be the upper thoracic region where the spine of that area is sitting on the styrofoam roll. The next thing to happen is that Kate takes a huge breath and rises about 1 centimeter toward my hand, and then she exhales and drops back, and she lets the part of her spine that's on the roll fall back in relaxation while her neck hand spreads through the whole neck and doesn't let the neck move. So the target area is where my hand is waving at the camera. That's the part that relaxes over the roll. This hand that supports the neck and doesn't let the neck joints move. Another breath in, she rises, she relaxes and exhales, and that part of the spine that is touching the styrofoam roll is the part that lies and relaxes and gains motion. Usually we ask a patient to do this 3 to 5 breaths. As we move to the middle region, I'll ask Kate to come up onto her buttocks with her hands lifting her up, and she's going to scoot her pelvis just 3 inches toward the direction of the head. Okay, then you lie down, and as you lie down, you're now going to be on a new region of the thoracic cage. And the knees have to bend. And then because we're getting lower, there's a tendency for this part to arch up. So what we can do with that is put this foot on top of this knee. And then that will passively make the lumbar spine less likely to move in this region. And then we would do the same thing. Ask her to protect her neck with a big spread of her fingers, and then take a huge breath and rise toward the ceiling and exhale, and the part that's on the roll would then fall back and not move down below here. So breath in and breath out, not letting the lower part move. And then we would do this, and we'd ask the person to leave the air out until it feels uncomfortable and they need a breath, which is usually 8 to 10 seconds. So breath in, breath out. After all the air out, 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, breath in. And there would be 3 to 5 of these repetitions to loosen up this region of the thoracic cage. Okay, then to go into the lower part, she'll put her foot down, she'll come up to sitting using her elbows, and she'll scoot again. And this time when she comes down, the roll is hitting her below her shoulder blades. So she's on the lower thoracic cage. Now, we're going to have a change here. This foot is going to be on the knee, and this hand, the neck hand, is going to come to the inside of the hamstrings right here, because for some people, to hold themselves up with abdominals is not practical. They might be too weak with the abdominals. So she's going to use her arm and her abdominals for when she takes a breath in and rises. Go ahead. And exhale. And then you release slowly with this part. You leave the air out 8 to 10 seconds. After the 8 seconds have gone by, you take a breath in and you use that elbow to bend and pull yourself up. And then slowly relax. And she's doing a nice job of not letting excessive motion occur down below. And she's taking caution with her head and neck that it does not strain. All right? So this covers a regional specific way to address the flexibility improvement of the upper, middle, and lower thoracic cage.